Good morning, viewers. Welcome to another episode of Monitor Your Health, the program where we enlighten the public on contemporary health issues. My name remains Dr. Funmi Ogunremi. I'll be your host for today, and we have today a very interesting topic. Again, we'll be talking about telehealth in Nigeria, especially during this time of COVID. And I have with me today someone very reputable that I know will be able to actually handle this topic. And who is the person of Dr. Funmi Adewara. Dr. Adewara, you're welcome to the program.
Good morning, Dr. Ogunremi. Thank you for inviting me. I'm pleased to be here.
Thank you so much. So, please, can you introduce yourself to our viewers?
Oh, well. As you have said, I'm Dr. Funmi Adewara, and I'm the founder of MYH Health International. We are an integrated telehealth company, and our mission is to make healthcare accessible to people around the world, particularly Africa. And we are live in Nigeria and expanding into other African countries. Right. I trained in Nigeria as a doctor in University of Ibadan. Then I came here over 15 years ago, or thereabout, to pursue my postgraduate training like many doctors. And then I have a master's degree in bioscience enterprise from Cambridge, which helped me to be where I am today. It's kind of contributed to what I'm doing. I have a stint in biopharmaceuticals, working in as a drug safety physician within the NHS, and I also work as a stroke physician.
Thank you so much. That's a big CV as well. Yeah, so you're welcome. Now, telehealth, we know that as it's were now in the whole world, not even Nigeria, COVID-19 has come to hit us, and a lot of people are scared. People are scared of everything, to be honest. Getting out becomes an issue. And then I've had people who have refused to actually go to the hospital because they're panicking. Is it that they said that the doctors are not attending to them again, or they said that they're scared when they go to the hospital, they're going to, contract or COVID-19. And I know with the good work that you do in MYH Health, there have been a lot of, uptake. So what is telehealth?
Thank you for providing that very succinct overview of the situation. Telemedicine is not new. Telemedicine and telehealth are often used interchangeably, very loosely, but telemedicine simply means the use of modern day technology to provide clinical care to patients remotely. So the doctor and the patient are not necessarily at the same location or in the same room, unlike what you have with a face-to-face inpatient visit. So we can now use modern day technology, whether it is a phone call or your smartphone, video calls, SMS, to now consult with a patient. So that's what telemedicine is about. Telehealth, however, encompasses more in terms of all the healthcare services that you can provide through digital means. So for instance, it can cover training of the healthcare professionals, peer-to-peer communication in order to discuss patients, and provision of remote monitoring and the rest of them. So telehealth is quite broad, but telemedicine just simply means provision of clinical care to patients remotely using modern day technology. And the technology has been in existence for decades. It's well established in the US, it's gaining popularity in Europe, even in Africa, it's not entirely new. It hasn't succeeded for various reasons, but now with COVID, there has been a huge uptake and people are now more willing to embrace telemedicine, given the fact that you just mentioned that people are scared of going to the hospitals, of contracting COVID, and the doctors are also scared of seeing patients. And that was at the initial period as well, when hospitals were shutting down just so that they don't get exposed to COVID patients, because you never know if somebody walks through your door, you don't know, there's no way of telling exactly if they had COVID or malaria or something else. And so that was the situation. So with COVID pandemic has really thrown telemedicine to the forefront as a cost-effective solution and in addressing most medical problems.
Thank you so much for that introduction. And so the viewers at home might be thinking like, yes, you've talked about the fact that you use modern technology to actually, enhance delivery of healthcare and things like that. In Nigeria, how do we see, the modern technology? What's the uptake? Of course, before COVID, and now that COVID is here, do you have an idea what's the uptake and things like that?
Well, globally, there has been a massive uptake of telemedicine. I mean, in the US, you have providers recording over 500%, 1,000% increase in adoption. In Nigeria, it has, before COVID, it was on a very slow pace. It was quite difficult, not just getting the patients to embrace telemedicine, but also the providers and the decision makers, just getting their buy-in had been very, very slow and difficult until COVID. Now with COVID, people have very limited choices and they're now more willing to explore. So we, as a provider, Mobi Health has seen, for instance, a jump in adoption because we have, when the COVID started, people now know that, oh, how can I check my symptoms? How can I know that I have COVID? So there were different providers who provided online checker, like triage system, and we're one of those. And I think you also did one, so many other providers, so that patients can access the platform and check their risk of COVID. But beyond that, they were also able to consult with a doctor. It was quite fascinating for most of them, and they could now see the benefit of it.
Wow, thank you so much.
Adoption has been better than before COVID.
Right. So yeah, sorry, there was a bit of interference. I think the network is fluctuating a bit. Yeah, so okay. Yeah, I didn't hear what you said the last, just for like a second or two. I think we missed that.
Yes. So I said, so the adoption has been much better now with COVID than the pre-COVID era. And people are more willing to explore telemedicine, and we have seen an increase in uptake.
Okay, thank you so much. So I know for us to have this increase in uptake, obviously there is a gap that we're breaching here, and that's why this jump. How has that been? What gap have we been able to fill, or what has that actually brought? What has telehealth brought as an advantage into the system? I know you mentioned.
Yeah, telemedicine has the potential of transforming the healthcare system and helping Africa, particularly Nigeria, to leapfrog. We are one of the fastest growing markets in mobile technology adoption. We have about 90% mobile penetration in Nigeria and 30 to 40% smartphone penetration. Now, we know that we are very far away from the WHO standard when it comes to the doctor-patient ratio. Nigeria currently has a population of 200 million people with about 40,000 doctors, 90% of who are on their way out. So we have 72,000 registered doctors, yes, but more than half of us are outside the country. And 9 in 10 of those that are left behind are on their way out. The UK government recently relaxed their visa rules, attracting healthcare workers from Africa and Nigeria. So that spells doom. And what telemedicine can do is to help to mobilize doctors, whether it's from urban area or the diaspora, to the continent, to help to improve access to healthcare while we're addressing all these perennial issues that limits access, whether it's the poor infrastructures, the shortage of doctors, the lack of skilled workers, in different areas, specialists in different areas. So telemedicine provides this unique opportunity, given that mobile penetration is huge, for Nigeria to be able to bridge that healthcare worker supply gap. And also, you know that majority of our population live in the rural communities. So there's a geographical barrier already, people having to travel very long distance to access healthcare, to get to the next clinic. And also, even after they have had the consultation, you also have the barrier of how to pay. Most of them do not have the financial means to pay because 95% of people lack access to health insurance, So also being exposed to a counterfeit medicine is another barrier to access. Now, technology offers the unique opportunity to bridge this gap because through technology, you can actually lock out the counterfeit medicine network. Patient can get access to doctors, qualified doctors, because they have been verified and checked. So you're not going to be seeing a quack doctor. And if you're getting your medicine from a reputable network, then you're very unlikely to be exposed to counterfeit medicine. If you live in a very far area, in the rural area where there are no doctors, technology, telemedicine affords you the opportunity to see a doctor in urban area or anywhere without you leaving your house, the comfort of your house. And we know that 60% of medical problems can be resolved through telemedicine. And this is what people need to know, that you do not need to go to hospital every time that you're ill. You can easily, just the same way you're doing your mobile banking and flight booking on your phones, you're doing WhatsApp call, Skype call. Technology offers this opportunity for you to be able to also improve your healthcare, your health by gaining access to the quality care that you need remotely and within the comfort of your home.
Thank you. Now, Nigeria is quite peculiar in certain characters and even services that we deliver. We're talking just earlier on when we started this program, the internet started fluctuating, and then I panicked a bit. Oh, I hope it's not going to just mess things up. So people might be thinking, okay, yes, we have the mobile phone, we have the this and that. Well, how do we get over the hoop of all these challenges around network issue wherever we are, and then whether we need smartphone to actually connect, whether there will be questions around that, and even data and things. So how do the common men, or common man, how does he see this, and how do they get over such for them to connect with telehealth?
Correct. So there's a lot of work that needs to be done in investing in digital infrastructure. For every frontier technology, you need the digital infrastructure to be able to drive adoption. So there's a need for further investment if Africa, Nigeria wants to leverage and to be able to tap into the current digital revolution. We need the gains from it. We need to be able to invest more in digital infrastructure, broadband, rural connectivity. So that is one issue. But right now, from where we are, we can still continue to save lives. So people can use their toll-free lines. It doesn't just have to be smartphone users. You can access a doctor through your mobile phone. If you have a feature phone, you can just call in through a toll-free line, for instance, and get access to a doctor. You can walk into a telehealth clinic that is solar-powered and has SATCOM. This we are providing for rural communities. So there are different models that can ensure inclusiveness and ensure that those at the bottom of the pyramid, who make up the majority of people that lack access to basic healthcare, can actually benefit from the technology, from telemedicine.
Right, thank you so much. And what's the role of the government in all this?
That government has a role definitely to play in driving mass adoption, whether it's in policy formulation. Right now there's no blueprint for the adoption of telemedicine in Nigeria. It's sad because this is a unique opportunity for us. We need to leverage this COVID pandemic to really bring the right policies that will ensure patient safety. How are these doctors being recruited? What are their credentials? The healthcare providers, clinical governance, ethics, all these need to be put in place. So it's the government's responsibility to be able to drive the policies that will guide adoption, ensuring patient safety. What should be the policy around prescribing? We have opioid problems, opioid abuse in Nigeria. You definitely don't want a doctor prescribing opioids over a teleconsultation. There are some guidelines that need to be put in place in order to ensure patient safety as these technologies are being adopted countrywide. You also want to, the government can also create more awareness, and because governments around the world, in the US, in the UK, you would have seen tenders being put out. Can you hear me?
Yes, I can hear you. Sorry, I was trying to, yeah, I can hear you.
Tenders being put out, and the government integrating telehealth, telemedicine into the health insurance scheme. This is what the government in Nigeria can do to bring telemedicine to the forefront and to the last mile. We need to integrate this into the state insurance scheme so that the common man can access it, and it will be affordable for those who are at the bottom of the pyramid. And also, the government can support the entrepreneurs by creating enabling environment, incentivize the startup companies who are working in this area. So there are quite a lot of things that the government can do, and we can work together to make this a reality, because we know that the government has made rural health their focal point. We need to now work together, both the public and the private sector, to make this a reality for the common man.
Yeah, thank you. And the common man, like you just said it now, usually the patient should be at the center of our care. And for everything we do, whether from the supply end, the government end, we still need to put them, into consideration. And there might be questions around, as a patient, I have issues, and presently, if I go to see doctors, there are so many things that goes on in Nigeria that sometimes you hear they're mind blowing. Maybe patient going to the doctor, the ethics of practice and things like that. Even when I see the doctor. Now, I'm now going to be doing a remote consultation with a doctor I can't see. Is there concern there? I mean, how, because I know this will be some of the worries from the patient, that am I going to get the appropriate care that I need? Am I going to, am I going to actually get well without somebody touching me? We have that belief that until you check blood pressure, you flush people's blood and things like that. It's a lot of myth in this country. So how do we go about this in telemedicine, telehealth environment?
Thank you for asking that question. Yes, there's a lot of work that needs to be done, definitely, in patient education, creating awareness, and just giving this comfort. Telemedicine is a well-established technology, and even in advanced countries where this is being practiced, you still have spots of rural areas where telemedicine have been deployed successfully. So it's not entirely new, it's been proven. 60% of medical problems can be resolved through telemedicine, that you don't need to go into the hospital to go for every time, because 70% of medical problems can be resolved at primary healthcare level. But because of the lack of this doctors or qualified personnel at the primary healthcare level who can look after their healthcare needs, or because of the deficit in the infrastructure, people just do not have faith in patronizing them. And instead of that, they end up going to the secondary and the tertiary centers, further congesting the place, which are meant for as referral centers. If there is a need for proper restructuring that would allow the requisite skills to be deployed to the primary healthcare level. And this is how telemedicine can really support to boost, the supply chain within the primary health sector, and ensure that patient can have confidence. But there's a lot of work that needs to be done in educating the patient about how telemedicine can support in diagnosis. The quality of the doctors, the experience of the doctors matters. In normal hospital setting, that a junior doctor will need supervision of a senior colleague, like before they can make diagnoses and all that. So there's a supervision. In telemedicine, there's probably no supervision. So it is very critical to know the quality and the experience of these doctors that are being deployed to provide telehealth. That is very important, because that will make a difference between making a right and a wrong diagnosis. So you want to ensure that the doctors that are seeing you has the requisite qualification and experience behind them, not just a house officer, not just a junior doctor alone being able to make that they have requisite skills, and whether they are nurses or those at the primary healthcare level, they must have the requisite skill to be able to make this diagnosis. When it comes to physical examination, technology is changing things rapidly. So at the early days of telemedicine adoption, there were quite a lot of concern, and that was one of the significant barriers to adoption. People worry about, oh, I don't know if this doctor, you can't listen to my heart sound, you don't have my blood pressure, how do you know what I have? But now technology is changing that. So we have remote physical examination devices. So the doctor can now get your vital sign. You can use your BP monitor at home and upload your readings so that the doctor can see it and help you to check the pattern and then advise you on medication, adjustment. This helps to improve, the healthcare of the patient, because you don't have to wait until 3 months or 1 month before you go for your checkup. As soon as you see that your readings are not right, you and the doctor can communicate and adjust your treatment plan. There are other physical examination devices that can help to check the heart sounds. We even have remote monitoring of we have remote ECGs. We have ultrasound scopes that are app enabled now. And we have devices that can be used to check the ear tympanic membrane, the ear examination, throat examination, and this can be forwarded to the doctor. Some of the ultrasound scans that we have now, you can be on the screen and the other healthcare provider is on the other side, or the patient, and they can use it to do a scan, and the doctor can see that on the screen as in, like it's in reality. So technology is changing things rapidly. So there's a lot of comfort in that, but telemedicine does not solve all the problems. It does solve significant, if you can solve 60%, that's quite remarkable. But there are instances where the patient needs further evaluation beyond the scope of telemedicine. So the patient should be sent to a provider who can evaluate them accurately and then offer the requisite, the necessary treatment that is required.
Thank you. That's quite exciting, to know that we can do so much, through a remote access and virtual space. Obviously, with everything going on now, I think we're now having a new normal. And the truth is, I don't think we're going to go back to where we were before COVID. So COVID has come, it's changing our world, and it's high time that we just take it and know that that's it. And we need to learn how to live with this virus. And I think one of the big things is this telemedicine, telehealth, that we're talking about today. Now, having said that, when we look at Nigeria as a whole, you look at the geographical distribution and the socioeconomic distribution across the country, a lot of people are below, the thresholds that we talk about from the socioeconomic, band. And then the concern that we might have is those ones in the remote parts of the, of the country. How do we hit them? Because in all honesty, they are the ones that really need this service more than those ones that they have the money, they can approach, or they're in the city, they can actually go to the, to the nearest hospital if it's necessary. But when you look at people in rural places where there's no healthcare facility, this is a big barrier for us. How do we go about this? How do we explore? What opportunity can we? How do we explore helping these people, because they are the one more in need?
So technology has the potential to change, to make unsustainable healthcare models more sustainable. And telemedicine actually is a cost-effective way of providing healthcare. It's a fraction of a face-to-face visit. For instance, it's been found that the actual cost of treating uncomplicated malaria is only 6.6% of the total cost. The rest is spent on facility maintenance and personnel. So imagine the cost savings if you do not have to have that. But importantly, for the rural communities, you have to create an inclusive product to be able to reach those at the bottom of the pyramid. And that is because technology has the potential of improving efficiency, but it also has the potential of widening the inequality gap that exists if we do not take conscientious effort of developing solutions that will address the broad spectrum and that will get to the last mile. So what we have done as a telehealth company is to provide solutions that are tailored to individual needs and that covers everyone within the whole value chain. So we have solutions for the telehealth for the rural communities, for instance, where we can deploy our prefabricated containers. They have solar power, they have SATCOM, and patient can easily walk into the telehealth clinic. They will meet our telehealth care, our staff there. They get onboarded on the platform, registered, and these are solar powered and they have SATCOM, so you don't need to worry about the internet or data for the patient. They don't have to bear that cost. We also have point of care testing tools within the telehealth clinics. There's a tool that has been developed by someone in Uganda, Matibabu, and it's a malaria parasite testing kit. It's just a very low cost testing kit. You have different devices that have been developed as well. So we have point of care testing tools that can be used in low income countries and are not cost prohibitive. But importantly, to make healthcare is a fundamental human right, and it is the government's responsibility to make that available to those who cannot pay for it. And that is why I mentioned when I started off that it is very important and critical to have the government buy-in and to be able to integrate this within the state insurance schemes, national insurance scheme, so that those at the bottom of the pyramid can afford that can have access to this intervention.
Wow, thank you so much. That's quite useful.
And I'd just like to add, Dr. Ogunremi, that there's no language barrier. So patient can walk into the telehealth clinic and be able to have a consultation with a doctor who speaks their language, a healthcare professional, a nurse, who speaks their language. We can train traditional birth attendants. We can upskill the local healthcare workers. We can do skill transfer, task shifting. So there's so much that you can do through telemedicine, and you don't have to have a lot of money to start. That's the good thing about it, that where you are right now, you can immediately begin, to reap the benefit. You can immediately begin to make an impact, leveraging on what currently exists. As low as 1,000 naira, 500 naira, people can enroll into the scheme. We have plans for 8,000 naira a year, that for a family of 6. So this I think is the way to go. Telemedicine provides the opportunity for Nigeria to leapfrog and to bridge that gap in our healthcare system.
That's brilliant. So I was going to go, talking about the opportunity that is there where patients can actually, get doctors who speak language, who understand their local, cultural needs and things like that. I know on your platform, I'm talking about Mobi Health now. I know that you have opportunity whereby people can connect with local doctor, they can connect with international doctor. You have all these things going on. How does that help in leveraging this situation? We know that obviously from what you said earlier on, because of the issue that is going on or issues that are going on in the country, a lot of doctors are moving. Just like last week, we had, I think, 40-something or 50-something doctors where, they exited to the UK without even visa, so they're making life so easy for doctors to leave. And then we're still having a lot of issues here in terms of, WHO's recommendation is that you have one doctor to, I think, is it 500?
600.
600 patients. But in Nigeria, it's about 1 to about 6,000 or something like that, or even more.
In the best of areas.
Yes. So we're very, very far away from where we're supposed to be. And this is the wrong time for us to be losing our doctors, en masse. But we can't, you and I can't help it. We just hope that the policymaker, the government will look into this and understand that Nigeria needs more than what we're getting now, especially from the health perspective. However, we know that from our own little way, the contribution we can make is to try and deploy things like this telehealth, platform. So how do we leverage, or how are you leveraging the opportunity of these doctors, hemorrhaging to developed countries to be able to contribute back to the country?
Yeah, you're right, doctor, and that's one of the main driving force for me. You know, I saw technology as an opportunity to mobilize the diaspora doctors, because I saw my colleagues who had to leave the country because of the need to, you know, gain quality postgraduate training, and also to improve their own livelihoods and have a better life for their families. And this continues to drive emigration of doctors from the continent, sadly. The remuneration, we know, in Nigeria is very poor. Until even COVID, until May, I think that the doctors Azad allowance was pegged at 5,000 naira. So, you know, and the lack of training, lack of opportunity to secure postgraduate training, residency training, continues to drive the mass emigration of doctors to the Western countries. So every week, for instance, the NHS registers over a dozen doctors from Nigeria. So this is not good for us as a country. And we can see what has happened even with this COVID pandemic, where countries are now more, we're witnessing the globalization, and people are now more protection. We're working towards protectionism, where people are, you have your money, but even when you go to the international to go and buy test kit, you can't get test kit because you're outbidded by the US, you're outbidded by the UK. So Africa needs to start to look inward to strengthen our own system inward. Why should we be importing 70% of our medication from China and India, for instance, essential medicines? If these countries shut their borders, then that is a big problem for us as a continent. So we need to start to look at how do we put in policies? How do we need to implement this? There are policies in place. Implementation is a problem. How do we implement these policies to help to retain the doctors on the continent, to help to train the requisite number of doctors that we need? Now, the challenge is that if assuming we get everything right today, you need average of 7 to 8 years to train a doctor, and then before they go through postgraduate training. WHO estimates that for Nigeria to get to that number of doctors that we need, we'll probably need more than 100 years. What telemedicine can do right now is bring about this, change this narrative immediately. So the doctors can immediately begin to provide teleconsultation to patients regardless of their location. And we have many diaspora doctors like yourself who are doing fantastic work, you know, and they're interested in helping the continent, regardless of where they are, whether they're in Canada, US, or the UK, and also supporting those who are at home. So we're not just bringing these doctors from the diaspora, we also have local doctors. So what Mobile Health is doing is mobilizing these doctors. We are building a database of 100,000 doctors across various specialties who, through our platform, a secured HIPAA compliant platform, can provide teleconsultation to patients in their language of choice, provide prescription service, diagnostics, we do referrals, we do home health, follow up. And if the patient then needs to have a medicine, we are partnered with reputable medical service providers like MedPlus, Health Plus, so we can send it to them and they can get their medications delivered to their houses. So this is one way that we on our own are helping to bridge that gap.
Okay, well done, and thank you for that. Now, you know, I mean, I'm in Nigeria as I speak with you, and I'm very fortunate to have seen both sides of the ocean, like I always tell people. And being here in Nigeria, I can see how chaotic things are, quite chaotic from the health point of view. Now, from the telehealth point, I know that we have a lot of people trying to enter into this, into this space. There's so many, organizations trying to put one thing or the other together. I have a worry. The worry I have is when we fraternize and then, we're all over the place, then the center cannot hold again.
That's right.
And of course, we have about 200 million people, so the scope is wide. I mean, there's a lot of work that needs doing. We need to, so many people that would need this service. But I feel it would probably be better for us to come together and then see how we can forge together and be stronger. What's your view about this?
You're absolutely spot on. So we have a fragmentation of the digital healthcare landscape in Nigeria. We have different providers doing different things. And it creates a lot of inefficiency, and also can create a lot of information overload for patients. By coming together, like we have the American Telemedicine Association in the US, which I'm a part of. We have a body like that in Europe. We need to have something like that in Nigeria. I understand that there was one that was formed, but it's not active. We need to come together and it's in this unity that we can actually make significant impact. Like you said, the numbers are great. There's a great room for collaboration, and I believe in partnership. And I think that's the way that we should see it, rather than we should have collaborations between different telehealth providers, different digital health providers, so that we can curate these different innovative solutions together and approach this in a very cohesive manner that will make it much easier for the patient. It will make it much easier for us to approach the government and the policymakers as a front, as a body, rather than working in a fragmented way. So absolutely spot on. Thank you, Doctor.
Thank you. So now, there's an aspect I really want us to touch on before we start rounding up. We've talked about doctors. We've talked about the fact that we lack loads of doctors. Doctors need to be, we need to find a way of utilizing, their skills wherever they are, as the country has invested in their life before they move back. The reason why I'm back here is when I think about it, how much this country has actually invested in me before I had the opportunity to actually see the other side of the ocean. And yes, I equip myself. Well, back home, I really want to put in back. How do we see other providers? Because it's not only about the doctors. Yes, the doctors are important, but the doctors are important, but there are other skill sets that is also going to be part of this consortium for us to be able to actually deliver what we need to deliver. What's your suggestion, your advice on that?
So you will notice that Mobi Health is an integrated platform. So we have all providers it's not just the doctors. We have nurses, physiotherapists, occupational health therapists. We have a psychologist, we have the mental health support team. We have social workers. So there's a need for integration for you to be able to provide an integrated service to be able to make this kind of impact that you're looking at. So it is, it's very important, absolutely, to be able to galvanize all these other healthcare providers and service providers as well. So we have pharmacy network, we have diagnostic network, we have hospital chain. We can all work together in collaboration, and the market is big. It's big enough for every competitor. I don't think all the digital healthcare providers right now can even handle 10% of the population of Nigeria. So the market is big. There's room for collaboration. We do not need to have an antagonistic market competitiveness. We can work together in collaboration, to at the end of the day, our solution needs to be tailored in a way that is patient-centric, that at the end of the day, we can deliver value to the patient. That is the utmost priority. And that is what we stand for.
Thank you greatly, Dr. Adewara. So we're getting to the end of this program. And, I know you've said a lot about Mobi Health. Usually what we do on this program is, at the middle of it, we talk about Area Doc as well, which is, also a telehealth platform. But I want you to just, use the next 2 minutes, just tell us about your service, how you think, it would be very valuable to Nigerians, and then I will then round up.
Well, thank you again, Dr. Ogunremi. I think you're doing a very great job. I commend you as a visionary leader. I see all of the things that you're doing on different fronts, from cancer screening to the Area Doc app that you have developed. And it's quite impressive and inspiring. For me, I did introduce myself earlier on, but Mobi Health, our mission is just simple, is to make healthcare accessible to the ordinary man on the street. Healthcare is a fundamental human right. It is the right of every human being, regardless of your geographical location, your social standing, your financial standing. You are a VIP. Everybody, when you're sick, you need to be able to entrust your life and your care to the hand of somebody that you know that cares, that can show empathy. And so for us as a company, our goal is to make healthcare accessible to everyone, not just those who can afford it. And we're looking at solutions that can make this, that can help to support the government. So we're looking at financial inclusion products, for instance, that can make it easy for people to be able to pay for their healthcare. You may not have the financial means, but there might be other things that you can do to be able to defray the cost of your healthcare. So some other health, for instance, maybe some healthy behaviors that we are trying to promote, you can earn points, tokens through that. You can clean the environment and get some token towards that. And that can help to pay for your healthcare cost. And for Africa, for Nigeria, for instance, I believe that we need to leverage on the explosive mobile technology growth in terms of our healthcare financing model. There's absolutely no reason why we shouldn't be able to tap into this, because if you, for instance, Nigeria spends $8.8 billion on airtime and data. Just so from that, why can't we use that opportunity to attain universal health coverage, so that every mobile subscriber, there's a deduction that goes towards their healthcare. There's a deduction that goes towards every time that you top up. You should be able to, if you can top up your phone, then you should be able to provide to contribute towards your healthcare. And I think that is a way that we need to start looking at healthcare financing, sustainable healthcare financing model. So for us at Mobi Health, our intention is to continue to work with government, with individuals, with corporate organizations to provide healthcare to the last mile. And we're leveraging on different inclusive products as well as solutions for those at the rural, hard to reach areas. Thank you for the opportunity to speak to you.
Thank you so much. That's really great. I sometimes, see all those areas that you've been to, all those awards that you've collected around the world, how you've actually, before I knew you personally, I always think, wow, that's a great one. This kind of people are the people I love to relate with, because you make Nigeria great. And for every, I've seen you in all fronts. So thank you so much. Now, just rounding up now, Nigerians, you say I know that there are issues in this country. I had a case, very, very simple case it just hit my heart last week, where a young man had just something as simple as he was diagnosed early diabetes quite sometimes back. For some reasons, he couldn't get somebody to speak to. He couldn't afford medicine, like he said. And then the next time they're seeing him, he's already developing, diabetic foot and things. It's quite painful to me. And I just thought, wow, why would they be like this in a country that is so rich as Nigeria? Possibly, it might be that for such patients like that, they do not know that opportunity like this exists. Just pick your phone, send a text, call, or, at least you can speak to someone. Okay. Sometimes there are opportunity as well. It's not all about the fact that you can't pay. We know that even on our platform as well, we have people who cannot afford it's not a lot of money that we're talking about. They can't afford just simple things. There are ways we can actually support, we can signpost you, try and link up with one reputable, opportunities like this. And that's why we bring people like yourself to come to the program, to come and let people know that, what your good service, what you're doing exists. At least it can then help Nigerians. Nigerians' life do matter. It does. It's very important for us to know that no matter what's going on around us, you don't close up and not, explore opportunities. So the opportunity is there. You have your mobile phone, either call, either chat, whatever. You can get an advice on the next thing to do, so that you don't just put your head in the sand until it's too late. This is a similar thing to what happened in breast cancer. Like I always say, people leave things it's too late before they come. But the opportunity is there, and then they sort of totally just ignore it. So Nigerians, please, Mobile Health is a reputable, mobile health platform, and that, just like you've heard today, as much as Area Doc also does something similar to that. And then we'll be looking at a way of collaborating and working together to deliver even something bigger. So we implore, Nigerians to please tap into this. Do not leave things too late when the solution is in your hands. Thank you so much for watching this other episode, and we look forward to meeting you again next week with another interesting topic. Have a nice weekend, and God bless.
Thank you, Doctor.